Welcome everyone to this webinar from the Australian Alliance for Artificial Intelligence in Healthcare. My name is Farah Maghrabi. I'm co-chair of the Safety, Quality and Ethics Working Group of the Alliance. We'll start in a moment. In the meantime, just some quick housekeeping. The Q&A is at the bottom of your screen, so please use it throughout to add questions. After each presentation, we're going to take one burning question, and then otherwise we're going to keep everything to the end for the panel discussion. So first we need to acknowledge country. On behalf of this gathering, I'd like to acknowledge the traditional custodians of the lands from which we are joining this session today and pay my respects to their elders, both past and present. I'd like to extend that respect to all Aboriginal and Torres Strait Islander people who are also with us here today. We have a great program today as we celebrate International Nurses Day. The theme for 2021 is a vision for future healthcare. So it's very timely that we showcase AI in nursing and how it's changing the way we deliver care. We'll be hearing both an international and an Australian perspective, specifically focusing on the work of the Alliance. Now, I'm very pleased to introduce Professor Enrico Coiera, who is the lead of the Alliance, and is also founding director for the Centre for Health Informatics at the Australian Institute of Health Innovation here at Macquarie University. Enrico will provide an update on the work of the Alliance in Australia. Thank you very much, Enrico.
Thank you, Farah. That's a nice welcome. And I'd like to welcome everybody on behalf of the Alliance to what is now, I think, the third webinar in an ongoing series that we have around important topics for healthcare and AI. So from the perspective of the outsider, when you look at healthcare and you look at what is said around AI, you would be surprised to think you would tend to think that the focus essentially is around medicine and diagnosis and radiology. But in truth, historically, if we look at digital health, we look at the big areas of where decision support has worked. Nursing has certainly been a major part of our focus, for example, around medications administration and management. And with the increasing focus now on aged care, care in the home, or people in long-term facilities, there's a lot of interest in using AI to detect people at risk of critical issues like falls or pressure ulcers or deterioration. So I think the whole focus on nursing is one that is actually quite critical in terms of delivering high quality care across the spectrum from the home through to tertiary. And I think today's focus, I think therefore is very timely. What I would like to do is to just spend a couple of minutes talking to you about the Alliance, because it might be the first time you've heard the name of the organization. And the Alliance is really a community of practice that has been around now for about 2 or 3 years. It's largely Australian in focus, as the name suggests. And you can see here in the slide that we have membership from industry, from government, health service providers, and a nice chunk of academics who all obviously enjoy Zoom. And the focus of the Alliance at the moment has been around what we call flagships. Farah has mentioned that she's working around safety, quality, and ethics and co-leading that working group. There's also one around workforce, how we train the workforce, one around precision healthcare, consumer healthcare, and also we've had a COVID working group over the last 18 months too. So there's a lot to do. And the last thing I just would like to mention before signing off is that this year's focus really for the Alliance is to recognize that it's quite a complex and difficult space to navigate, that and it's also quite difficult to run these slides, it seems, and that we need to have everybody together in common purpose. So we're going to focus on what we call a roadmap, which will try and highlight what needs to happen nationally in collaboration amongst the different groups. So if that's something that you're interested in from the nursing perspective, I think Jenny can put in the chat her email, and you're very welcome to contact her. We're always looking for people to help us think through the big issues, what needs to happen, and I would like to see in our Alliance roadmap a clear strategy for engaging the nursing workforce, but also to making a big impact in healthcare through that engagement. So with that, I'll thank you, and I'm looking very forward to the next two presentations, which I think are going to be very enlightening. Thanks again, Farah.
Thanks very much, Enrico. Our next speaker is Assistant Professor Charlene Ronquillo from the Daphne Cockrell School of Nursing at Ryerson University in Toronto, Canada. Welcome, Charlene. We really appreciate you taking the time to join us here today. Charlene will be speaking about AI in nursing and showcasing international priorities and opportunities. Thanks very much, Charlene.
Thank you so much, Farah. Sharing my screen here. All right, first, before I begin, I wanted to thank you for the kind invitation to join you today, this Nursing Day, Nursing Week, to speak about artificial intelligence in nursing. Before kicking off, I'd like to first begin by acknowledging the land where I'm joining from today, which is the unceded territory of the Syilx peoples in the nation we know as Canada. The presentation today that I'm going to be covering is a paper that we've got coming out shortly that are talking about priorities, opportunities, and recommendations that resulted from an international invitational think tank on AI use in nursing. So I'll go over that now. So before kind of launching in, I kind of began developing this presentation, assuming that everybody is familiar with definition of AI. For the context of this presentation and the paper, we did go with kind of as broad of a definition of AI as there is. There was a lot of back and forth during the workshop around what kind of definition of AI do we want to use. So we went with one of the early ones by McCarthy, where artificial intelligence, or AI, is defined as the science and engineering of making intelligent machines, especially intelligent computer programs. You'll notice in my presentation that a lot of the kind of AI technologies that I'll be referring to are still quite far from truly kind of intelligent and autonomous type of technologies, and more around, largely around prediction, risk identification, and things like that, but using approaches that are used in AI, so things like machine learning, natural language processing, and deep learning, etc. So with that in mind, introducing you now to the kind of motivation and the background and the rationale for why we wanted to put together this workshop. Nurses are the largest group of healthcare professionals in healthcare systems internationally, and also nurses complete the most documentation within healthcare systems. So it follows then that given that AI technologies draw from the data that are in electronic systems, nurses are inextricably linked to what is possible to do with AI because they do so much of this data collection. And so, you know, the quality of the data that nurses collect, the nature, the ways that we document data are all going to shape what is possible to do with AI in the future. But despite this link, there is a limited discussion or engagement with AI in nursing that we felt needed to move forward on. And so as part of the Student and Emerging Professionals group of the International Medical Informatics Association, we came across an opportunity provided by the Brochure Foundation in Switzerland, where they host workshops, events, and kind of academic stays to examine the ethical, legal, and social implications of technology use in healthcare. And so we were successful in obtaining some resources and were able to develop this workshop. And our aim really was to catalyze a discussion and outline some critical recommendations for AI in nursing in the near future. So recognizing that, you know, there's limited kind of critical discussion around this, we wanted to start to catalyze that discussion by inviting international experts in the field across different types of specialties. And I'll go into the specialties that were in attendance as well. The format of the workshop, we first conducted a pre-conference survey, which was to gather information about kind of initial thoughts, trying to get a sense of where participants' heads were at in terms of thinking about AI in nursing, to help us design what kind of discussion we wanted to have at the workshop. And the workshop itself were 3 days that comprised expert presentations by the attendees, and a lot of time we've allotted for working sessions and discussions to really dig deep into the kind of engage with the debates and the ongoing issues and challenges that we were anticipating over this event. So at the AI for Nursing workshop, we established the Nursing and Artificial Intelligence Leadership Collaborative, where it always sounds like a big fancy group once you put a name to it, but we're a group of interprofessional academics, researchers, policymakers, etc., largely from North America and Western Europe, who came together to engage with this process of identifying priorities and creating these recommendations. So I do like to highlight that the participants and the members, the current members of this collaborative, are largely from the North American and Western European context, just to highlight that, you know, our views represent those regions largely in what is in those regions, and recognizing that we do, you know, we are missing big chunks of representation moving forward, but we hope that that can change and we can incorporate more diverse views as we move forward. And so the first day of the sessions looked like presentations and discussion points. So we had presentations from clinical information, clinical informatics operations, philosophy of technologies and AI, focused on AI specifically, experts and researchers in biomedical and clinical informatics, and leadership at the international level in terms of AI initiatives that are happening. So we had the chair of the International Telecommunications Union and WHO focus group on artificial intelligence for health. And the discussion for that first day, or the first half of the day, were to identify key stakeholders and groups for statements in AI in nursing, and identify state-of-the-art examples of AI use in nursing. And the second point actually proved to be quite a challenge. So there are a lot of pieces out there, publications in terms of AI in nursing that are largely speculative or go more into debates around, you know, what can we gain? What are the things at risk? What are the concerns, kind of thing? But it was difficult to identify actual uses of AI use in practice. And so one of the outcomes that came out of this actually is a project, a scoping review we've got ongoing to try to identify actual applications of AI in nursing, and trying to see kind of what that practice piece looks like and what this use actually looks like in practice. And that's ongoing currently. The second half of the day for day one started to look at the implications for AI and in health and nursing, with presentations from the perspectives of primary care, engineering, computer science, nursing, and a lay perspective. And incorporating a lay perspective was really important for us, as we wanted to ensure that we have some kind of grounding, or at least a little bit of insight into what reactions might be to some of these discussions that were being had. It's very easy for academics to get into kind of these grand discussions. So it was really valuable and critical for us to have the lay perspective there to kind of bring us back down to earth at those times when, you know, we really needed to ensure that the discussions were person-centered and, you know, always keeping the patient interest at the center. Discussions for the afternoon included kind of this longer discussion that we had around how would you actually define AI in nursing, what does that actually look like, and what are nurses' roles and responsibilities related to AI. The second day continued on the discussions of implications of AI in health and nursing, with presentations from nursing, people that are working in technologies in general, informatics in general, healthcare operations, biomedical ethics, and law. And so shifting gears on that second day to start to examine the ethical considerations that need to be considered, the legal considerations that need to be considered. What are the power relations that we're dealing with, that we're talking about, who is represented and who isn't, whose interests are represented and who isn't, whose aren't. And then the second half of the day, wrapping up by looking towards the future of AI in nursing. So zooming out a little bit in beyond kind of the immediate clinical scenarios to start to look at the bigger picture. What is this relationship going to be, or what do we need to kind of envision for the future? So starting to look at kind of, can we use AI to shift population health? And what is that relationship between nursing and AI and population health in relation to disparities, in relation to standardized terminologies? Can we leverage international organizations, international professional organizations as a way to disseminate ideas? And what are the ways and how can AI potentially revolutionize and change nursing work in the future? And so the discussions for this day, or for this half of the day, we're looking at identifying what are the most important areas where AI development needs to happen in the next decade to help nurses to provide better care. And we really did want to delineate kind of an immediate future view to make it as actionable as possible, the resulting recommendations. And then also starting to try to forecast and identify, what are some of the major barriers to achieving these advancements for nursing, and also identifying what are ways we could potentially mitigate these barriers or overcome these in moving forward. The working sessions on the third day were to wrap up final discussions, start to draft some of the key messages that we wanted to communicate in the paper. What are the actionable recommendations? And again, being a nurse myself and having that background, I'm always looking for the application end of things. How do we actually make use of this information? And so creating actionable recommendations was something that was really important for us to develop. And then also start to discuss and develop, talk about the future of the group and what are the next steps that we wanted to achieve. So after the 3-day session, a lot of interesting conversations were had, but a bottom kind of a core message that we'd all agreed on is that given the potential magnitude of impact of AI tools, so you've got the potential magnitude of impact of AI tools, the size of the nursing workforce and nurses' roles as, the really large source of or shapers of data, we argue that there is an ethical imperative for nurses to have a minimum basic understanding of AI. So we realize this is quite bold. So this is really sending the message that, it's not nice to know. AI is not nice to know for nurses, but as we increasingly use these technologies as part of our practice, we have an ethical imperative. It should be viewed as part of our fiduciary duty to have this minimum basic understanding of AI. And I'll go into kind of what these basic understandings might look like in the later slides. But arguably, the position that we're taking is that, using AI as a tool in practice should not be any different from the requirement of nurses to have a basic understanding of any other tool that they use in practice. So whenever we have a new procedure we need to do, a new tool that we need to use, nurses always need to be aware of, what is the evidence behind this? What are the pros and cons of this? How does this relate to patient preferences? How does this relate to the larger plan of care? How does this relate to informed consent, privacy, ethics, the relationship between the person and the care provider? Arguably, AI is just another tool, and we need to know all of these things to be able to kind of efficiently and knowledgeably use it, and to ensure that the needs of our patients and the person remains at the center. So to move AI in nursing forward, we identified several priorities, but these are the three key that we kind of landed on in terms of immediate priorities, or things that we can take active steps towards now in order to kind of move this conversation forward in a thoughtful way and in a way that ensures that nursing needs are represented as AI develops. So the first is that nurses must understand the relationship between the data they collect and the AI technologies that they use. The second priority is that nurses must be meaningfully involved in AI. So beyond kind of tokenistic representation, but meaningfully pulled in from at all stages. So from development to implementation. And the third is this potential or a goal that should be developed or worked towards, which is kind of this idea of AI for good nursing. And I'll go into each of these priorities in these coming slides. So this first priority, first of all, I should say that how we've kind of framed each of these priorities are first identifying what are the gaps are either in understanding or action, and then posing recommendations to try to address those gaps. So each of these priorities are going to be presented in this way in these next slides. So in the first priority of that, nurses must understand the relationship between the data they collect and AI technology that they use. Some of the gaps identified, I've mentioned already that nurses generate the most data in health systems as they complete the most documentation. And so understanding this, that the nature and the quality of data collected and documented as part of care can and do directly inform AI tools, and that these, can actively shape what is possible to do with AI in the future. So if we're collecting data in an unstandardized way, or we have poor quality data, that limits our abilities or makes it that much more work or that much more complex to try to then make use of those data for purposes beyond kind of immediate record keeping. Which leads to the second point, that there's a limited understanding currently of the link between nursing documentation and their purpose beyond the immediate situation. I can speak to the North American context, where a lot of what's taught in undergraduate nursing education around clinical documentation in terms of its purpose is still largely in relation to having a legal record and perhaps informing immediate care. And we're arguing that as we increasingly incorporate AI, we need to think about these data as beyond being a legal record, but actually being a source of data that could be actively used for secondary purposes. We also suggest that nurses can serve as a last line of evaluation of an appropriateness of an intervention. So clinical decision support tools, AI-based or otherwise, have various levels of uncertainty that require clinician interpretation in terms of the use. And nurses are already very good at doing this. So we base or gauge our recommendations that we receive from decision support tools or otherwise in the context of our knowledge bases, in the context of patient preferences and values, in the context of our own experiences, and in the context of evidence, and making sense of all of these together to then inform, clinical decisions and our clinical judgment. And so we argue that particularly for tools that may have higher degrees of uncertainty, that nurses can be a crucial kind of intermediary in terms of then helping to interpret or understand clinically what these recommendations might mean and what, how to decide to follow an AI-based recommendation. And another gap is a lack of expertise in teaching health informatics and AI across all levels of nursing education. Again, I can speak largely to the Canadian context, as that's where I'm most familiar, but there aren't folks with informatics training, let alone AI training, and having the nursing clinical training as well. And so that's a significant barrier in terms of moving forward the field and moving this education forward. So in terms of addressing the first priority of supporting nurses to understand this relationship between data collection and AI technology use, one suggestion that we have is developing a curriculum of minimum AI and nursing competencies for undergraduate education. And this would entail kind of illustrating this basic link. So one of the key aspects of it would be that teaching around clinical documentation, not just as a legal record and not just for immediate clinical decision making, but potential implications for future reuse. As well, there's a need to prioritize, I have recruitment here, but even just training of faculty, training of enough academics that will have kind of a nursing background and the AI or informatics background, and then supporting them to be, or recruiting them, prioritizing their recruitment into faculty roles to ensure that nursing education will start to pull in or start to have AI education embedded as part of basic nursing education. In terms of practice, some of the things that can be done to address the first priority would be some version of this AI for nursing competencies. That would be for then directed towards continuing education rather than undergraduate education. Providing options for in-practice training on specific AI that are used in that specific setting that would allow for nurses to gain an understanding of how they would navigate, whether it's recommendations that's made by a system, how would they navigate that? What other sources of knowledge do they need? What other sources of information do they need to facilitate their decision-making? And also allow them to understand that relationship between how they practice and the recommendations being made by an AI system in an environment that is safe, where there are not going to be implications or potential unintended consequences for patients. Practice recommendations also include developing structures or supporting the development of structures that promote continuous discussion of the implications of AI technologies in nursing at all levels. And in terms of the developer side, ensuring that AI system outputs are transparent for nurses. So being able to illustrate in some way, how are decisions being come across, what data sources are being drawn from, to then support nurses in understanding the links between kind of the inputs and the outputs of the system. For research, researchers can examine the use and impact of AI in nursing and the impacts related to workforce, clinical, patient health outcomes. There's a lot of discussion already around making the AI life cycle explainable. And one of the things that are, I'll discuss a little bit more in a later point, is that a pretty untapped resources is looking at the potential contributions of nursing to AI technology development and implementation. And I'll go into the specifics of that a little bit later on. For leadership, recommendations include leaders having a sufficient understanding of AI to be able to lead implementations with the needs of clinical teams being kept in mind. So we're not talking that clinical leaders need to be experts in AI, but have enough understanding to be able to then prioritize that these technologies will serve the needs of clinical teams as a core function of it. Creating opportunities and tangible supports for continuing education and training for staff. So if we're talking about this idea of minimum AI for nursing competencies, one way of conveying the importance of this would be providing tangible supports like, protected time for practicing nurses to actually complete this education. And that ties into that third point around promoting nurses' attitudes towards learning about AI. So by doing things like having protected time, that sends a very clear message in terms of what is valued, and how it's seen as important in an organization. The second priority is the need for nurses to be meaningfully involved in all stages of AI, from development to implementation. So nurses currently, part of the gap is that nurses are often target end users of technologies, but rather than collaborators, or are perhaps pulled in a tokenistic way. Nursing is also an untapped resource in terms of contributions as advocates for social justice and having expertise in relational care. So those of you who are nurses who are joining us today, you know that one of the foundational underpinnings of the profession is being concerned with beneficence towards patients, communities, populations, and this advocacy for social justice. And a lot of the discourse in AI relates to bias, potential for exacerbating inequities, embedding, human biases into technologies. But we haven't looked at, nurses are already geared towards advocating for social justice and towards equity. And so, how do we make use of this expertise to then inform better AI, or more equitable AI, or less biased AI at the very least? And then AI development must start with a thorough understanding of the clinical question and clinical workflows. And this is, a key contribution that nursing can make in many ways across the AI lifecycle. So, 3 potential distinct and important roles that nurses have are as informants and communicators. So they can help by delineating what the clinical problems actually mean, serving as intermediaries between clinical and technical spheres, and then incorporating features of relational practice. So nurses nurses are experts in relational practice in terms of considering relationships with patients as part of what is weighed in delivering care and in clinical decision making. And so, how do we make use of that? And we would argue that that is a huge untapped resource in terms of designing better AI. So some recommendations to address the second priority in terms of education. Some of the things that could be explored could be partnerships and collaborations between nursing educational institutions and industry, technology teams within hospitals and things like that, with the idea of exposing students, at the undergraduate level, exposing them to what kind of interdisciplinary technology development could potentially look like. And this would support the development of the language and ways of working that nurses can then enter into practice with, to be able to identify what clinical needs are and how these would translate to asking for, the needs in terms of technologies and what would support their practice. In terms of practice recommendations, nurses should play an active role in AI technology development and deployment in clinical settings. Again, recognizing their roles as central communicators and intermediaries in clinical settings can support the implementation of these technologies. As far as research recommendations, encouraging participatory and co-produced approaches to research design, to leverage nursing expertise in relational practice. And in terms of leaders should build organizational structures to afford nurses opportunities to be involved in all stages of AI creation. And I want to point out here that, we were very intentional in including leadership here and the role of leadership in providing the infrastructure. It's all well and good to say, nurses should do more education and this, that, and the other. But without the infrastructure support provided, a lot of the times can only be made possible by leaders and advocates. It's very difficult to do this on a practical level. And the third priority is AI for good nursing. For those of you who may be familiar with the various different groups and various different efforts that are happening in the sphere of artificial intelligence, one of the things that you may hear a lot about are these AI for good things. So there's AI for good health, etc. And so we, we're talking about this idea of AI for good nursing, and it's this idea of how do we use AI to help nurses be better at what they do. And so looking at kind of beyond the immediate clinical problem, but looking at the profession as a whole and at the globe, at the population levels, really. So how do we use AI, to improve nursing kind of everywhere or anywhere? The gap identified is that there's a limited recognition and limited exploration of this relationship between AI and nursing and the nursing profession in relation to global goals and humanitarian efforts. And some of the recommendations for moving forward AI for good nursing in terms of education could be using things like virtual environments or simulations to really focus on patient-centered and relational care. Providing an environment where nurses can practice how to or develop skills and obtaining informed consent that also address issues like digital privacy and security and data ownership. These are not routinely part of what we do currently in nursing. It could be that we don't have the language for it yet, what have you, but providing these environments where we can kind of practice these skills and gain the language and the knowledge to use these in practice, as we increasingly use AI, could be really helpful. As well, assessment of digital literacy. We saw, everyone's kind of a bit tired of hearing about COVID, but with the huge shift towards online care, virtual health care delivered online, this is assessment of digital literacy. Again, it's another thing that we don't routinely do as nurses, but increasingly is going to be more and more relevant in our practice. As far as practice recommendations go for AI for good nursing, AI can be used to support having more time for preventative approaches, AI being developed to incorporate more holistic and person-centered patient perspectives. So how do we leverage nursing knowledge to be able to do this with AI or to have AI support this? As well, nurses need to be aware of potential areas of bias and how to flag these. At the bottom line, nurses need to be aware that there can be biases in kind of the development process, in the application process, but we need to be aware that these exist, these potentials for bias exist, and also know how to flag these. So if we are noticing that some technology or clinical decision support seems to be drawing from skewed data or is disproportionately affecting some groups over others, is there a mechanism for flagging this to be looked into further? In terms of research, researchers can examine the types of AI technologies that can best augment nurses' critical thinking and care skills. Again, thinking about how we can use this to work to support nurses be better at what they do, understand how AI will impact workflows and outcomes, and understand how equity and social justice considerations can be incorporated into AI. And leadership recommendations would be, ensuring that achieving economic efficiencies is not the sole driver of AI implementation. This was a big point of discussion during the workshop. So, although some of the promises of AI are things like, freeing up time so nurses can spend more time with patients, so nurses can spend more time engaging with research and being up to date on evidence. It is a very real concern that rather than having that time freed up be spent on quality of care, we can instead be pushed towards increasing quantity of care. So rather than time freed up for, more thoughtful care or catching up on evidence, what's not to say that your patient load is just not going to, increase by some amount. And so leadership has a core role in ensuring that it's not just economic efficiencies that are in mind when we're talking about implementation, and ensure that AI use takes a more proactive rather than a reactive approach than what we currently see in healthcare. So the bottom line, all of this, kind of starting to wrap up now, is that AI technologies will change the profession of nursing one way or another, whether we like it or not. The extent to which that happens is yet to be seen, but it will, practice will change in some way. But we kind of, we put forward two potential, positive things. So if nursing takes a proactive role in addressing these priorities, so if nursing truly takes a driver's seat and takes hold of this development, AI does have the potential to enhance and extend nursing capabilities. And in return, I've highlighted already some of the untapped potential, but nursing has a lot to contribute to the development of AI systems that leverage nurses' strengths and expertise in relational practice, patient advocacy, and towards the development of AI that considers patients with a more holistic view. So I will wrap up there. And again, thank you for this opportunity, and I will hand it back over to the host.
Thank you so much, Charlene. That was a fantastic kind of talk indeed. It's great to see, really specific recommendations along the lines of education, practice, research, and kind of leadership. And indeed, there is a lot that we can take away from it as we look to kind of develop our own national roadmap. So we'll kind of hold questions until the panel discussion because in terms of, some of the recommendations that you're making and for nurses to be kind of more proactive, our next speaker is doing just that. So I'd like to, it's my great pleasure to introduce Sabah Akbar. So Sabah is a nurse who is a registered nurse and a PhD candidate at Macquarie University. So she's going to present her work on integrating AI to support nurses in decision making. Thank you so much, Sabah.
Yeah, thanks for. Yeah, very correctly. My project is in line with some of the recommendations that Charlene shared. And so, hi everyone, I'm Sabah. I'm the final year PhD candidate at Macquarie University here in Sydney. And my project looks at using AI to help nurses identify patient risks in timely manner. And when I talk about risk, I'm mainly concerned with hospital-acquired complications, or HSCs. So these are the complications, the kind of adverse events that happen within the hospital when the patient is admitted. And research suggests that they are mostly preventable. Within Australia, the number of HSCs have increased over the last decade, and the most recent statistics said there were around 5.4 events per 100 separations. So the numbers have been growing up. And on the right, you can see the list of top 10 hospital-acquired complications. And again, this is the list from Australia. And I have highlighted the first two, pressure injuries and falls, because these, I believe, are very nursing focused. These are the two assessments that we do the first thing when patients come to us in the hospital. And even with the others on the list, there is very important involvement of nurses in terms of assessing patients for the risks and identifying when the interventions are needed. So while talking about nursing roles within the risk identification, it is also important to look at our favorite care process. This is the systematic cycle that we use when we're dealing with our patients, starting from assessment, which is essentially gathering all the information about patients, and then identifying either potential or actual problems, and then planning our goals and identifying interventions that would be helpful, and then implementing those, and finally evaluating whether or not we've achieved the goals. Now, it all starts with the assessment, and this is where we make our most important decisions about what to assess and when to assess, because there's like a bunch of risk assessments that are applicable to different patients, but then what to do and when to do are important decisions. Fortunately, we have systems called decision support systems in nursing that help us make informed and evidence-based decisions. Some of the examples of decision support systems in nursing include assessment forms. We then have physiological monitoring tools, for example, vital signs monitoring chats or nutrition intake output tools, etc. We also have risk score calculators, and what they do is calculate risk for certain hospital-acquired complications for us. And then there are care plans that help us navigate through this whole care process. Over the years, the forms of these decision support systems have evolved. So starting from paper-based systems, paper-based tools, we now see more electronic tools in place that are integrated within the EHRs. We also now see the advancement in a way that these tools are now able to talk to other technological equipment. So for example, there'll be tools that can gather data from patients' smartwatches or activity trackers, etc. So we see this advancement happening over time in decision support systems. Now, when we started this project, we were interested in looking at what is the current landscape of decision support systems like. So we did this systematic review where we included 28 studies. Each of them was looking at a unique decision support systems. And interestingly, what we found was most of the decision support systems in practice today are supporting the functions of assessment and implementation. So what they're doing is they're giving nurses a list of questions to ask from patients. So that's kind of assessment, and then they're helping them decide what to do. There is very minimal focus on evaluation. So whether we achieve what we wanted to do, not a lot of decision support systems support this function. We used an established framework that explains stages of decision making where automation can be applied. And we found that most of the decision support systems have automated features that help with information analysis and decision and action selection. What this means is most decision support system asks nurses to manually enter data, so that's information acquisition, and then generate a score or analyze that information, and then give out recommendations for what kind of decisions to be taken. And then again, nurses have to manually take those decisions. So most of the automation is in the center part. In terms of effects, so we looked at how is this actually affecting the practice, and we found mixed reports of decision-making, care delivery, and patient outcomes. So some decision support systems made positive impact in these categories, while there were some that had no significant impact. And there were also some reports of harm caused by decision support systems. So pretty heterogeneous data in that manner. Following up on this systematic review, we did a qualitative study where we talked to nurses. We conducted semi-structured interviews about their perceptions about current decision support systems. We interviewed 15 nurses, and we had a mix of bedside nurses and nurses who are more in supervisory roles, for example, unit managers or patient safety officers or coordinators, etc. We had a good representation from all kinds of nursing units, medical, surgical, oncology. We did non-critical mainly, because that's where we thought about more decision making is involved in terms of what and when to assess. And we found the workflow pretty consistent. Okay, this was a national study, so we had nurses from Australia, and we found that the way the intervals where the assessments are done is pretty consistent overall. So we start with initial assessment. That's the first assessment when patient comes to the hospital. Then depending on the risk level, there is either daily or per shift assessments or weekly, or when there's a change in condition. Now we asked nurses about what are their perceptions and what are some of the challenges with this process. Most of the nurses said that this workflow is pretty justified. So the intervals are convenient, they are appropriate. However, there were also discussion about possibility of missed assessments, because if you're doing a weekly assessment, what happens if a patient needs assessment during the week? So there is opportunity for missing those assessments. We talked about different tools that they use to assess, and nurses verbalized that those tools extensively cover all aspects. However, there were reports of missing individualized factors. So those reports have standard factors that they're looking for, but that miss individualized factors. Again, about the tools, they said that the tools cover subjective and objective components both of assessments, which is a good thing. It's an overall assessment thing that the tools are supporting. However, the challenge is that these subjective assessments then lead to variability in nursing decisions. So two nurses assessing the same patient may have different outcomes. So there is variability there. Nurses have found possible workarounds around this workflow. So for example, for doing it each week, hospitals now have dedicated a day for each assessment. For example, there is Waterloo Wednesday, which is every Wednesday you have to do pressure injury assessment. So that's kind of a workaround. However, most participants said that there is insufficient understanding of what is being assessed. So not all factors are clearly described. There was unanimous agreement on how important these assessments are for patient safety. However, for most nurses, it's not a high priority task. So although they agree that it's very, very important, it is still is low priority task because there is heaps of things for nurses to do. This is just another ticker box activity, just another documentation to do. And so it's low on the priority. Now these interviews gave us some really useful insights, and we went ahead and designed our prototype system that helps nurses, that automates the risk assessment process and helps nurses identify risk in a better manner. This is in a testing stage right now, and we're looking forward to roll it out as an experiment in the next couple of months. And we'll be looking for Australian hospital nurses to participate. It'll be an online study that you can do at your own convenience. And if you're interested to help us test or participate later on in the study, please reach out to us. And I look forward to connecting with all of you for this study later on. Thank you.
Wonderful. Thank you so much, Saba. So let's now kind of move to the panel discussion. If I can ask everyone to kind of come back online. We have a whole bunch of questions here. The first one is for you, Charlene. Clearly, you've done some really great work with the NAIL Collaborative. Can you kind of talk about where it's going and how Australian nurses can get involved?
That's a great question. That's in development as well. So we just, we're finalizing kind of this paper that's coming out, and I think we're due for a conversation actually around how to best move forward. So there were some initial discussions and kind of very non-pandemic friendly ideas at the end of that workshop in terms of what to do next. So I think we're due for a regrouping, but certainly I mentioned already, we identified that as one of the limitations that we had in terms of representation. And yeah, I'm kind of happy to bring forward if there are interests. We would love to get representation from as wide as possible, because we recognize that a lot of the perspectives there were from places with not that Australia isn't moving forward, but thinking about other countries as well. Like the infrastructure is just quite different, and so the realities are very, very different, and that's something that we really try to be mindful of. But so the long answer to it's in development, and there will be opportunities. Especially the AI for good initiatives. That's something that's on my plate. It's just everything's a bit wacky at the moment, but that is something that we're hoping to have to get going and gain some more momentum around, and have there's talk of having an AI for good nursing stream as part of the AI for good events that are happening, but that's still kind of the logistics of that are being worked out, but there will be opportunities.
Cool, thank you for that. Our next question is for Enrico. Enrico, so much of the development at the moment is kind of focused on deep learning and kind of machine learning. What do you see? Where do you see this going? What do you see kind of in 5 years' time?
A good question. And I would argue that it's not that it's what's happening, it's what you hear about. So all the excitement is around deep learning, and people think deep learning is AI, where AI is a huge set of methods and techniques which have been around forever. And I think I mentioned in my opening comments, decision support for medication administration, which might be rule-based, but it's still a kind of an AI, and it's widely used. So I think in some ways I worry that the hype is excessive, and often it comes from, not from the healthcare space, it comes really from the technology space. It's also clear looking at where the activity is, it's where I would say there's a lot of technology push. So in a place like radiology, there's a lot of data, and Charlene spoke about the importance of good quality data for machine learning. So in radiology, tons of data, but also highly billable So industry is very excited about automating radiology, because if I can semi-automate that, I can get a cut of the money and away I go. And that's universal. You know, I know the structures of health systems are different, but in every nation, that's about the same thing. Whereas nursing is much more of a pull space, where I think it's up to the community to decide what is important to it. And the solutions aren't going to be by an AI. They're going to be, let's reconfigure our practice. Let's change the way work goes. If we want to improve the management of pressure ulcers or falls, can AI help us maybe by alerting to which patients are at risk, change our practice for those patients? But the AI itself is only a small part of the whole thing. So I think where it's going is exactly where Charlene and Saba are talking about, which is for the nursing community to recognize this huge opportunity, but to recognize that it probably owns that future, because it's working in a very hard part of the space. It's not in the easy, high data, high billable space. It's somewhere where, you know, I love to see Charlene talking about AI for good. It's not to say you can't optimize and make efficiencies here, but the benefits are going to be in better care, I think, rather than necessarily, you know, saving bucks. So I think avoid the hype, focus on the very real opportunities, and recognize it's not a technology fix, it's a whole of system workflow, socio-technical, as we academics like to say, problem.
Saba, what advice can you give a nurse who wants to get into AI? I mean, you know, somebody listening today, what can they do next year in Australia?
Yes, I can say from my experience, I think the first thing we can do is just start getting involved. I feel like within hospitals, there's a gap between how IT departments work versus how nursing practices work. And we kind of, within Australia, I know we're trying to bridge that gap. We now have new positions of EMR specialists that are nurses. And so just getting involved in those projects could be a good starting point. Attending webinars like these could be a good point to start being aware of what's happening in the practice. Yeah, so just being involved and just going up there and talking to your supervisors, telling them that you're interested. And then, of course, if you want to go ahead and study more, I'm doing a PhD, so that could come at a later stage. I'm not saying do PhD, well, do PhD, but if you want to. But so that could be a later stage. I think the starting point just could be to get involved, participate.
Cool, thank you. Charlene, you kind of talked about, you know, nurses kind of being the last line of evaluation about the appropriateness of interventions. You know, can you talk through kind of a specific example? Because I guess I've never sort of heard anybody kind of capture it in that way. I mean, we sort of hear a lot about decision support systems giving advice to doctors, and then doctors deciding what they're going to do. But I've not sort of heard of anybody kind of describe the role of nurses in that kind of, you know, it's usually the clinician and the AI, and you're sort of suggesting, well, there's a clinician AI and there's a nurse in there too.
Yeah, and I think of that conversation more around looking at what I think of bias in AI and systems. You know, talking about nurses, like one of the foundational pieces that we are social justice kind of advocates. And so I think you're just in a position as a nurse, you know, say your patient is getting a particular care plan that doesn't align with, I don't know, their current like living conditions or their current means. Typically the nurse's role is to raise that and say, we need to come up with a different plan, or, you know, we need to rethink about this. So I guess I'm thinking about it in that way, in terms of, you know, if we're seeing, you know, these kinds of recommendations being made for this specific population group, it's that can be a really good role of a nurse, because those alerts, but like those flags are raised in our heads anyway around, you know, what is the underlying issue here? Are there equity issues at play? Are we overlooking something? I find this really difficult to explain, actually, in terms of this last line of defense. But I'm just thinking about it in terms of having that social justice and advocacy lens, the patient advocacy lens, and that being kind of the basis for when things would flag for us that something's not quite right. I think practicing nurses kind of know what I'm talking about. It's really difficult to explain, but something will flag you that is not quite right, and then you kind of take action based on that.
Wonderful. Thank you so much for that. We're just running out of time. We could probably, keep talking for another half an hour. So I just want to thank everyone for joining us on this webinar today, and thank you to the speakers for sharing your insights.
Thank you. Thanks, everyone.
Thank you for having us. Bye.
Thanks. We look forward to being in touch, Charlene.
Yeah, thanks.